Hello, everyone. I'm Dr. Yip. I'm from the Chinese University of Hong Kong.
I'm Noriya Uedo from Osaka International Cancer Institute.
So today we would like to discuss the recent publication in GIE from our team titled The Use of Diluted Epinephrine During Gastric Endoscopic Submucosal Dissection and International Randomized Controlled Trial. So Noriya, what is the background of the study? Why did you decide to conduct the current study?
Okay, so actually when I have invited to workshop for ESD, I was often asked what type of injection solution do you use or do you add epinephrine in the injection solution? And at that time, I always answered according to my personal experience or preference. But one day, I really wanted to know whether adding epinephrine to injection solution is truly meaningful or not. And initially, I investigated the efficacy of adding epinephrine to injection solution in retrospective study, and I found that it reduced procedure time of gastric ESD by 10%. So I'd like to prove the effectiveness of epinephrine added solution in reduction of procedure time of gastric ESD in a large-scale multicenter randomized control trial. And then I asked Honchi to collaborate together to conduct the study. So Honchi, please explain how the study was conducted and what were the main outcome of the study.
Yes, so this was an international parallel group, double-blinded randomized controlled trial, which was conducted at 12 institutions, including referral centers, academic hospitals, and general hospitals across 4 countries in Asia Pacific region. So the participants were adult patients with biopsy-proven gastric neoplasia who were scheduled to undergo ESD. We excluded patients who had multiple lesions or lesions at the anastomotic site, or those patients who are on double antiplatelets, warfarin, or other anticoagulations. We randomized them in a one-to-one manner, stratified by the institution, lesion size, and location, and we blind the patients, endoscopists, and the outcome assessors. The patients who were randomized to undergo ESD in the epinephrine group will undergo the ESD with injection solution added into diluted epinephrine, ultimately into a concentration of 1 in 100,000, whereas the other group will not have the injection solution added with epinephrine. However, all the other aspects of the ESD were equivalent in both groups, and the endoscopist can choose what knife or what other accessories or traction techniques that they desired in order to mimic as much as we can the real life scenario. The primary outcome was ESD procedural time, and secondary outcome includes intraprocedural hemorrhage, which was defined as significant bleeding requiring the use of coagulation forceps. And all the other peri-procedural adverse events were also calculated as the secondary outcomes. Finally, we were able to recruit 799 patients from 2020 to 2023. In each group, we have 386 patients in the epinephrine group and 388 patients in the control group. They were quite balanced in the demographic solution and also the other aspects of the ESDs. The primary outcome of procedural time was significantly shorter in the epinephrine group, 60 minutes versus 68 minutes, with a mean difference, adjusted mean difference of -7 minutes. The patients also had fewer intra-procedural bleeding events requiring use of hemostatic forceps, with a mean of 1.8 versus 3.0, adjusted rate ratio of 0.59. There were no other difference in the patients with delayed or intra-procedural complications. When we undergo post-hoc subgroup analysis, there was also consistent benefit of diluted epinephrine noted across almost all subgroups. In particular, the shortening of procedural time was more obvious in the larger lesions and lesions in the lower part of the stomach. And also it was consistent that the improvement was shown in both high volume and low volume centers and among experts and novice endoscopists.
Are there any potential limitation of this study?
Yes. So one of the main limitation of our study is that we could not blind adequately the endoscopists because once you injected epinephrine solution, the endoscopist might notice that the changing of the color of the mucosa and will understand the randomization allocation. The second thing is it's difficult to record the total volume of injection throughout the procedure because some of the solution were actually injected through the knife. And however, we noticed that with this large sample size, the difference is still significant, and we think that would not increase the significant bias. And finally, there was only a small proportion of patients who were taking antiplatelet agents, so we could not assess the effect of epinephrine in groups of patients who are on antiplatelet agents or even anticoagulations. So Noriya, what do you think of our study and how would this impact our current endoscopic practice?
Okay, so I think the addition of epinephrine to injection solution is very easy and universally possible for any type of solution and any setting. So I think generalizability is quite high. And initially we thought it may reduce incidence of intraprocedural bleeding and reduce number of hemostasis and shorten procedure time. But actually we found it also improved visibility of submucosal plane and recognition of muscle surface because of reduction of oozing bleeding during submucosal dissection. So I suppose it may also reduce risk of intraprocedural perforation as well. Moreover, while it is not directly related to the study finding, I'd also like to emphasize that this study is initially initiated from a small clinical question raised by endoscopy practitioner and was conducted through practitioner-based collaboration with international friends and colleagues. And it is possible to present strong evidence in such a way. So I hope this study promotes further clinical relevant international collaborative research in the future.
So given that you have further research in mind, what would you suggest in terms of the future direction of research along the same line of thoughts?
I thought the usefulness of epinephrine added solution could be investigated in a ESD in other organs. For example, like especially in the rectum, where thick vessel often cause severe bleeding during the procedure, I think usefulness of epinephrine added solution can be investigated.
Thank you. So Noriya, as the corresponding author of this paper, do you have any special final remark to the listener of the interview?
So, in conclusion, in this international multicenter randomized control trial, we proved that the addition of diluted epinephrine to an injection solution during gastric ESD significantly reduced intraprocedural bleeding and shortened the procedure time and benefits to clinical practice. And this technique is recommended as a routine practice in gastric ESD, we think. And at last, all investigators involved in this study are grateful to AMBIC, Asian Nobel Bioimaging and Intervention Group, and AERF, Asian Endoscopy Research Forum, for supporting this study conduction. That's all. Thank you.
Thank you very much.